when access to healthcare in rural Africa is a big problem. In fact, Africa at large, there is a huge shortage of doctors, not only in Africa, even in the Western world, right? So when you go to Africa and you look at the rural area, like where I grew up, we have a health center that basically doesn't have a doctor. It almost had only one trained nurse. I mean, like a nurse that is trained and is licensed. The other people that are there are like nursing assistants. And they're doing their job. They are working their socks off to do their good job and to be able to help people, right? But then when you have, for example, someone comes in and is in a critical condition, and you know the routes from that particular hospital, from that particular health unit to a good hospital in the city or in the town, it's something that for you to navigate when someone is sick, it's hard, right? So when someone comes in at night and is really sick, maybe the nurse doesn't even, or the nursing assistant doesn't even know how to look at and diagnose the person, and maybe even give some drugs that can even cool down the sickness or bring down the symptoms before they can be looking at, do you need to be transferred to a bigger hospital where you can see a doctor or all that. So are we in the place where AI can be able to help these rural areas when it comes to healthcare? Can we see an AI doctor?
Yes. And not just see an AI doctor. I've seen one of the best doctors in the world, and it's AI. Okay. So before I go any further, I would like to tell you this. Artificial intelligence just helped a company recently and has been approved by the FDA as of last week to start human trials. AI looked at the gene, at the DNA of humans and said, I know why you are getting old and dying. And he pointed out the gene. Yeah, I'm going to send that video to you on your WhatsApp so you can add it if you want to. Wow. AI looked at the gene of humans and said, I figured out why you are getting old and why you die because of that.
So you're saying we may not die in the future. Is that what you're saying?
Yes. So the FDA just approved the human trials for this drug. This drug does not stop aging. All right. I want you to listen to this clearly. It's not a drug to stop aging. It's not a drug to solve specific issues. It's a drug that reverses aging. Now, listen to that. It's not stop, it reverses it. So imagine you are 40, 50, 60, 70, and you want your organs and your body to go back to when you were like 30. It's now possible. And that happened not because we had the best doctors in the world. It happened because those doctors fed all their research, all their knowledge into an artificial intelligence. And he looked at their knowledge and said, hey, I figured out what you missed. All this research you've been doing all of the time, all from ancient times, all these things you've been trying to solve, malaria, typhoid, I've seen the mistake. It was in your gene, and I can reverse that for you. Now, coming to our rural areas, I just wanted to prove to you how powerful this thing is.
Yeah.
You have mentioned, I grew up in G4. If those of you who don't know, G4 is in the northwest region of Cameroon, somewhere around Ndu. It's very far off. Before, even getting to a phone, we had to drive to Banso. My father had to take a car and drive all the way to Banso to make a phone call. All right? You can imagine.
Some people used to climb on the hills to get network, you know?
Exactly.
Get a signal to make a call, you know?
Exactly. Imagine if you get sick, like you're honestly sick, you're really sick, and like you mentioned, you go to a clinic and there's just one trained nurse. Sometimes that nurse is overwhelmed with the amount of people coming in, and yes, she's human or he is human, and he get tired, you know? So maybe he has dealt with 5 or 6 or 10 cases that day, and you are at a level. The person is tired. You can't blame them. They're human. Now, how does AI help? AI has been able to, people have used AI for symptom checker, okay? You can literally whip out any artificial intelligence right now and you say, these are my symptoms, okay? Which is what every doctor do. It's known as consultation. What is paining you? My waist. When did it start? Yeah. AI is able to ask all of that and then tell you, hey, I think I know exactly what is wrong with you. You have this particular problem. I'm not a doctor. Of course, AI has been trained to say they are not doctors. But based on the research it has done or the training it has received, it's able to point out to the precise problem you're suffering and point out the drugs that will help you solve that problem. Now, getting to the drugs is another thing, but absolutely, I have seen even professional doctors use AI in their line of work. So yes, we are not only going to get healthier, we're also going to get solutions faster, because how long does it take for an AI to diagnose you? Approximately, you're using your voice, it's 2 minutes. Approximately. Wow. I've done the research, it's 2 minutes. How many people can concurrently use that AI at the same time? Up to 1 billion. So we can have 1 billion people line up in front of their phone and they are asking the AI, there are different kind of symptoms, and that AI is able to solve every single one of them.
It's going to be a life changer for Africa, especially the rural areas. I'm telling you, if this is going to be a life changer. I even saw on a story that on one report that Kenya is using AI to predict diseases. I think they said it used AI to correctly predict the outbreak of cholera in one particular region of Kenya, and they were able to prevent that. And I also saw that Ghana has a chatbot. I think that chatbot is called NurseBot? Something like that. That's helping the healthcare, that's helping nurses for healthcare in rural areas in Ghana. So these are already signs that things are happening, and the African countries are thinking about this, right? I don't know if every African country is actually thinking about this right now, but I believe that if Ghana is already trying that, and if Kenya is already trying that, and with the research that you are talking about here in the United States, they are going to obviously learn, and they are going to probably tap from there to build something that can help the rural population.
And this is my problem with the African nations, as I like to call them, the African states, because I don't even look at them as countries anymore. We sit on the best landmass on earth. The African continent is big enough to feed the United States 5 times with leftovers. Okay? I was hoping, and I've been fighting, I've been at the forefront. I've been talking with many decision makers at the African Union, and I say, hey, we need a unified African platform for artificial intelligence. We don't need Ghana to do it. We don't need Kenya to do it. We don't need Swaziland to do it. We don't need South Africa to do it.
I saw a report. Sorry, I cut you off. I saw a report that was done by Smart Africa, which is a blueprint for AI in Africa. Have you seen that report?
Yes, I've gone through the report as well, yeah.
Yeah. It's really good. It's solid.
Yes, and the problem I have here is Smart Africa came up with that wonderful report. If the African Union claims to be that body that unifies the African continent, well, maybe we're not ready to be unified politically. But what is stopping us to be unified technologically? What is stopping us to say we're going to create a curriculum for African kids in primary school, secondary school, and universities? By the time they get to the university, they must have this amount of knowledge in artificial intelligence. That has not been done. That has not been proposed. That has not gone anywhere. So you can see that, for example, if you look at this at countries like the United States, you look at Canada. The United States, it's 50 different states. Each of them working as a unit. They came up with their own AI curriculum and they're teaching their kids, right?
Another thing that people don't even understand is that these states have different laws, you know?
Exactly.
Right? They have different laws, but they still work together as a country, but they have really a lot of different laws.
If you look at the history, most states in the United States were French. They were bought from France. The United States paid money to buy Wisconsin. They paid money to buy states like North Dakota. It wasn't part of the United States. They bought these states. Washington State was also bought. So we as a people, going back to Africa, what is stopping us to come up and say, hey, okay, the African Union could literally just ask those who are experts in the field and say, propose to us what you think we should teach our kids when it comes to artificial intelligence. That has not been done. And so
the base is important. The base is important, to be honest.
Because of that,
if there's no base, I mean,
absolutely. Because of that, 5 years down the line, guess what is going to happen? There will be billionaires coming up who have used AI to become billionaires in the United States. And 5 years, we'll have no billionaire in Africa. We'll have brain drain again of young Africans who could have sat in Africa and say, how can I use this platform created by the African Union to make agriculture better, to predict prices of food products, to be able to save products and store them without a refrigerator. All of these things, they won't know it, and then they will not have to migrate to the United States. We will repeat the same mistakes that our fathers made, and we will do the same mistake.
I hope they. I know that we're going to talk more about this, but I hope we don't repeat the same mistakes. I hope they listen. I hope they learn, and I hope we can do something that is better for Africa.